Welcome back to Spotlight. I'm Ejuenka, and I'm here with Deputy Director of Social Security, responsible for National Health Insurance, Brother Roy Barry, and Chief Medical Officer in the Ministry of Health and Social Development, Dr. Ira Potter. Brothers, welcome to Spotlight.
Good evening, Edwinko.
Good evening, Ejuenka, and thanks for having us here this evening.
But it's certainly good to have you. I know you guys have been around and making all the rounds and talking, so I figure that people must have all the information by now. I don't know what to ask you. But I'm going to start off by saying, of course, that in my view, social security, NHI is to health what Social Security is to retirement, and this is a very important discussion that we're going to have. So I want to encourage everyone to gather around, get close to your phone. The number's going to come up on the screen because I'm going to open up the phones early because I figured that a lot of information went out, and you might have questions that I might not ask or not know to ask or overlook. So I want to give you the most of the opportunity to get your questions answered. So the phone number is going to come up on the screen any moment. Why is the need for national insurance at this particular point?
Well, the cost of healthcare continues to increase rapidly, and portions in the BVA, as record shows, we have about 65% of the population without health insurance. Of the 65%, a large number of these persons are unable to meet the cost of healthcare currently. The government of the day undertook a health reform. In that health reform included the improvement in the level of healthcare in the BVA. With the improvement of healthcare in the BVA will be an increase in cost. Thus, the National Health Insurance, which is a financing mechanism to help to create access to health care for the entire population and to offset the costs to these persons who can't afford more so. Thus, therefore, the National Health Insurance will create access to health care for the entire population. Because of our size, it is a bit difficult for us to just cater to persons who can't afford to purchase private insurance. If we had a population that was much larger, then we would be able to cater to those who can't afford to, and the persons who can afford, they would have purchased their own insurance. But with size in mind, and for the system to be sustainable, we had to include the entire population.
Okay. And that's why it's mandatory.
That is why it's mandatory.
Okay. So who are who are covered?
All legal residents of the territory are covered.
And covered for what? What care? What care are they covered for?
They're covered for a variety of care. It's we have primary care, we have preventative care, the hospital room and board, surgery, diagnostic procedures, intensive care, casualty and emergency care, pharmaceutical services, mental health, dental and vision, approved prosthetic services, and as well as overseas health care services for medically necessary diagnosis and treatments.
Dr. Potter, I want to talk a little bit about statistics. And with, Brother Barry mentioned that a lot of us can't afford healthcare, but healthcare in the BVA was for years, for up to now, subsidized by the government. Can you put that in a context for us where we could understand the what we're charging for healthcare, what the healthcare actually costs, and how what we're doing is not quite sustainable?
Health services in the territory are provided in the private sector and in the public sector, and to some extent by community-based organizations, religious organizations, and other non-governmental organizations. Healthcare has a cost, but healthcare is not like any other commodity. It is just not a service to which you put a price. Healthcare is recognized as a public good, and government has a responsibility under the law to ensure that members of the public have access to healthcare. People pay for healthcare mainly by paying fees that are charged for services. Fees are charged in the private sector, fees are charged within the public sector. One would recognize that the fees charged within the private sector are usually much more than the fees charged within the private sector. And that is because the services in the public sector are highly subsidized by government. And because government is aware that a lot of persons who need care cannot afford to pay higher fees, there's always been a reluctance to increase the fees. In the meanwhile, as we aspire to be able to give our people access to needed care and to expand the scope of services that are going to be required, what has happened is that the profile of conditions that we see in the territory has changed. Largely in the 50s and early 60s, we would have seen a lot of infectious diseases, communicable diseases. Largely, we don't see children with chicken pox, measles, mumps. We don't see polio. In fact, in the Caribbean, we've eradicated polio. In the Caribbean, we've eliminated the transmission of measles. We are well on our way to eliminating the transmission of German measles. And these have been by immunizations. However, with development has come access to high energy foods, high fat content foods. With development, we've increased our access to motorized transportation. We've changed our occupations. We've developed a service industry. So we are not fishing as much. A smaller proportion of our fishing, a smaller proportion of us are farming. So a smaller proportion of us are actually engaged in manual labor. So with our advancement in terms of our development, the occupations have changed. The things we do for leisure have also changed, in that we now have electricity in all parts of the territory. People are watching more electronic media. People are spending more time indoors rather than outside. Even children, the same thing is happening too. What has happened is that with the advances in medical care in the territory, several things are happening. One is that we are able to diagnose more conditions because we now have more capacity. However, the number of persons who are actually getting these conditions are increasing. So more people are having the chronic non-communicable diseases such as diabetes, cardiovascular disease, heart disease, strokes, cancers. The cost of treating these diseases is much more than the cost of treating the communicable diseases. And so the need for hospital services has in fact increased. We are a developing population that has not yet developed a significant value for health, in that we don't yet by practice undertake preventive measures to prevent illness. And so most people would not go to seek medical care unless they feel sick. And we have to do a better job of informing and educating people of the value of having regular checkups, of having regular screening for certain conditions, so that these things can be detected early when they are easier to treat, cheaper to treat, when the cost of the medical bill is smaller, and also the cost to families in terms of investment of time and displacement from work is also smaller. So the cost of disease conditions from which we now suffer has increased significantly. And so while people generally would pay for some services, in the organization of services as they are now, people who use the public sector, if they go to a clinic, there are hardly any fees. If you go to the hospital, the fees are very low. For the past 15 years or so, we've had a much greater increase in the number of persons in the community who have access to private health insurance. And we've actually evolved to a situation where the private health insurers have developed a network of healthcare providers, and they've agreed prices for certain procedures and diagnosis with the providers. And so it means that our healthcare providers are able to charge a better price for their services.
I mean, some people are getting price out of accessibility.
Well, some people cannot access some services because they can't afford. And for persons who generally can't afford something, they tend to delay having it. And usually when you delay seeking care, the condition gets worse. It becomes more costly to take care of. So we've had a growing private healthcare industry. However, until now, only about 35% of the population have private healthcare insurance, and the vast majority of those persons are really part of group health programs by which their employers help to sponsor the coverage. So for the mass of the population, they don't have the security of health insurance. The goal of the national health policy really is to try to improve the quality of life and the standard of living of the people of the Virgin Islands. In order to achieve this, we must ensure that people have access to needed health care. We must ensure that people have access to promotive health services, to preventive health services, to curative health services, to rehabilitative health services. Because when people don't have insurance to help to pay for their care, what happens is that very often the family has to spend all their savings to take care of ill loved ones. This results in financial hardship for some persons, and some persons in fact stand the risk of becoming bankrupt because of the sickness. The National Health Insurance Program will not only guarantee access to everyone, it will guarantee access to a package of services, and it will help to ensure that people don't suffer financial hardship because of illness.
Okay. That brings me to who's going to pay for what, since we're on the question of cost. The employer and the employee is paying equal share. Can you tell us what that share is, again, that percentage of the division of the cost?
The deductions for the national insurance system will be 3.75% paid by employers and 3.75% paid by employees. This is based and it's also based on a ceiling, which the ceiling for this year, if the national health insurance system was in operation, would have been $75,888 or $6,324 per month. In 2014, the proposed ceiling will be $77,208 or $6,434 per month.
Okay. And the ceiling means that's the highest amount that you're going to have to pay on. So
That's the highest taxable amount for national health insurance.
So a person making $80,000 a year is only going to be paying insurance on $77,000 and change.
Yeah.
Okay. And I guess the person making minimum wage is.
Well, Minimum wage is somewhere around $6.93 per month, and somebody making minimum wage will pay $25.98 per month, which is 3.75% of $6.93.
Okay, cool. So in a sense, everybody should be able to afford that and have access to the care, as Dr. Pato pointed out. All of us need to have that confidence and that security that when we feel sick, we could go and get checked in time. I just had the members of the BVI Cancer Society on, and one of the things that they were talking about was the fact that you need early detection, and if you can't afford the mammogram, more than likely
You won't go for that mammogram.
you won't go for the mammogram. So that's how important it is. Now, how important it is to we always talk about the employee, but how important it is to the employer to be able to provide the help, assist in providing the access to the employee.
Well, for employers, they themselves are going to benefit from a national health insurance system. They are going to have affordable health insurance plan for all the employees. So as we know, there are some employers who don't have a private insurance plan for them, but now all employees will have insurance coverage.
All employees and all employers
Yes,
will have.
and this will in turn give you more productive employees because they have access to early detection and prevention of illnesses. So with this early detection and the prevention, these employees are going to be much more productive. You're going to have happier people working in the workplace because they know whenever they fall sick or ill, they can access care because it is accessible based on the financing of the national health insurance.
Okay, let me just take this call. Thank you very much for calling Spotlight. Right ahead, please. Let me see. Okay. Can you please call me back? I'm having a little challenge here with a new setup. Okay. Yeah, you were saying.
In some situations, when employees fall sick, they have to seek salary advances from the employers. This will be no more because national health insurance will assist in offsetting the costs of any healthcare needs of your employees.
Now, a lot of that 35 to 40% that Dr. Pato was talking about that have insurance, employer subsidized insurance. Why should they, subscribe to the national health insurance? What is the benefit to them? And how important it is for them to subscribe to the national health insurance?
I deem it extremely important because you said the insurance they have is subsidized by the employers, and there's no guarantee you'll be employed by a specific employer for your lifespan. So what if you're unemployed maybe a year down the road? Automatically the insurance that you have with the employer ceases. That ceases no longer. With national health insurance, if you become unemployed, you're covered for up to 1 month of unemployment, and after that month, if it's deemed that you are unable to contribute on your behalf, government contributes for you, because the means testing mechanism will be completed to ensure that persons can or can't afford to contribute for themselves, and in the event that you can't, government contributes for you. But in the private insurance industry with your employer subsidizing your insurance, when you become unemployed, you no longer have health insurance, and the burden becomes yours. Any care you access, it has to be paid for out of pocket.
Okay, we got to take a break forward from our sponsors. We're going to come back with a discussion on NHI. Keep it locked right at the Spotlight. Don't forget to call me. I'm getting things sorted out during the break. We'll be right back.
Spotlight is brought to you by Tortola Concrete Limited, Clarence Thomas Limited, and H. Lavity Stout Community College.
Welcome back to Spotlight. I'm Edgewank. I'm here with Dr. Arad Pata, Chief Medical Officer, and Brother Roy Barry, Deputy Director of Social Security, responsible for the National Health Insurance. So we're talking about National Health Insurance. You can call me at 499-1328, 499-1328. The number's on the screen as well. And we'd be happy to take your calls. I think I have it sorted out. Yes. The quality, a lot of persons who have private health insurance, and I think the general population is concerned about the quality of healthcare in the territory. How is the quality of healthcare improving? Has it improved? What is going to be done to improve it? Dr. Pata, you want to take that?
One of the interesting things about healthcare is that it's an industry where the consumer knows very little about the technical aspects of the trade. Mm-hmm. And very often the dissatisfaction of consumers have very little to do with the technical aspects of the trade. Mm-hmm. Sometimes there are issues with the technical aspects of the trade and the industry. However, I also am always interested to get feedback from the public, because generally when things go right, as they most times do, you never hear. When things go wrong, you always tend to hear. And so in the main, I believe that the quality of healthcare in the territory is as good as healthcare anywhere else. We have well-qualified physicians, we have well-qualified nurses, we have well-qualified health practitioners in general. There are many reasons when sometimes things do go different than they ought to go. One of the things there are several things that happens to try to ensure that the quality of healthcare is good. One, there is a process for ensuring that the practitioners are suitably qualified to practice in the areas of care that they offer services. There's also a process for registration of health facilities. We are currently revising the legislation for registration and licensing of health care facilities, so that they will come into place a process of inspection of facilities to ensure that the services being offered, that the conditions for those services to be offered effectively and efficiently are in place, to ensure that the providers who are available at the various facilities, public and private, do have the knowledge and skills for the services which the facilities offer. There are also, within the public healthcare system, a process moving towards accreditation of the health services. The Ministry of Health is improving its capacity to set standards for healthcare delivery in the territory, in the public sector and in the private sector. And in order to do this, we are instituting clinical care guidelines for various conditions. One of the things that is happening both in the public and private sector currently is that the recording of health transactions is becoming electronic. What this does is that it helps to ensure that the processes that are prescribed to be followed for a particular condition are followed, and that there is available evidence to audit. So periodically they'll be instituted for healthcare in the territory audits. In some countries, you can go online and you can check for a particular facility what is their track record for a particular kind of procedure. Those are the things that we are aspiring to be able to do within our own country. We expect that the installation of the electronic medical record at People's Hospital, at Bougainvillea Clinic, will in fact allow us to be able to produce such information so that the public will be able to access such information. We also are providing opportunities for the public to be more engaged, better informed about various conditions and what should be done for those conditions. We are putting in place procedures for, in the public sector, for people to be able to lodge a complaint if they are dissatisfied with the service, and there are processes for investigating any complaints that are made. And we encourage people that if you felt that things didn't go as they should have gone, to make a complaint. And if you make a complaint, they have a written responsibility to respond within a certain time period and to give you a response. In addition, the Ministry of Health is modernizing all of the legislation that deals with the registration and certification of the professionals. The Nursing and Midwives Act is being updated. The Medical and Dental Act is the Medical Act is being updated. The Allied Health Professionals Act is being updated. So there are a number of initiatives in train already to improve those processes, which would help to improve, which will help to assure the quality of the healthcare that is delivered in the country. In addition, we are expanding the scope and range of services available in the territory by partnering with providers from other jurisdictions. Within the private sector, this has been happening for years. Within the public health system, on the ground, People's Hospital has partnered with HEMA Health. There are other discussions with other providers from Panama, from Miami, from the UK. There's been visits to other territories to look at what services could be accessed overseas, so that when there is need to refer patients overseas, we have an awareness of where we are sending people and what the quality of service is, where they are going to be going. All of these things are part of the initiatives that are being put in place to ensure that we do improve the quality of healthcare. More and more, we are accepting of the reality that when people perceive that something is not as good as it ought to be, that is in fact their reality. And we are beginning to understand that we need to take that literally and to engage directly with them, to have a dialogue, to understand what they perceive the shortcoming to be. And that is why we've established the complaint procedure, and we're asking people, if there is an issue, go to the health services, let them know what the difficulty is. If they don't know what you see as being wrong, they can't really address it. And so we must accept that the delivery of health services in the territory is very dependent on persons in the territory using the health services available in the territory. If we don't use our own health services, there is no way we are going to be able to afford to improve them. Part of our dilemma right now is that a lot of persons prefer to access care overseas. Well, healthcare dollars spent overseas cannot enter into the BVI economy. neither for investment in the health services or for any other aspect of our country. And so there is a direct and deliberate attempt to improve the quality of services that are available so that when people access services, they are happy with the quality. And so there's expansion of the public hospital, People's Hospital, and there's also proposed expansion of the Iris O'Neil Clinic and proposed expansion of development of a comprehensive clinic in the Eastern Outlook community and further developments in other communities in the near future. So not only will we be improving the inputs, we are going to be able to audit the processes, and we are going to be able to make public and transparent reports about what transpired, what was deficient, what was not deficient, and what the corrective measures are, which is part of our responsibility to the public.
I was, as you were talking about the facilities, I got some pictures of the inside of the hospital, and maybe just like to show a little bit about that in terms of the improvement. Yeah, they saw the kitchen. Those are the rooms, the patient rooms. It's the cabinet in the patient rooms. It's quite an upgrade. it's quite a facility upgrade. I'm really excited about it, and that's the intensive care, one of the intensive care units, and that's one of the operating theaters, and the nursery for newborns. There's a nursery for newborns there, another angle. And I'm just excited about all the electronic equipment and the state-of-the-art look of the New People's Hospital is really exciting. So there's a lot going on in terms of building capacity, building quality, and
locally,
and that's important because in order for us to improve, we need to spend that money here so we can have it to invest in healthcare. A lot of persons wants to know about their out-of-pocket expenses, about deductibles. Usually you have insurance, you need to have a deductible. If you're going overseas, you have the access, how you get, people want to go overseas to get health care. How do they do that on the NHI? All these questions keep popping up in the minds of persons. Is your NHI going to be accepted internationally? Address some of those issues first.
National Health Insurance will have a network locally as well as one overseas. In the local network, we will have agreed prices that we'll pay for specified services offered here. In situations where facilities probably might charge more than what we have agreed to pay, it will be advised that the provider will inform the general public of the variation in fees, and the patient will then knowingly agree to pay the difference. But
I'll go to a provider that's accepted in your fee schedule.
Yeah. Mm-hmm. And what happens in a situation where you access care and we have a specified ceiling in terms of a fee schedule, there will be a co-payment. And the co-payment rates at the community clinic is 0%. At the hospital, it is 5%. And the private providers in network, 10%. And out of network, 20%. Okay. Overseas, we intend to have providers in various jurisdictions also.
Scott. Thank you for calling. Spotlight, right ahead, please.
Hello, good night. I would like to find out. Yeah,
Good night. Yes, go right ahead.
Yes, I'd like to find out if you're a retired person, how do you get in the scheme? Yeah, if you have to make payments or something like that to get in the scheme.
Okay, thank you very much for the call. Just listen. Okay.
Okay. Retired persons will be required to register with the system. If the retiree's only income is a pension, then government contributes on behalf of that individual.
So he doesn't have to. He doesn't have to pay.
No, the government contributes on their behalf. In the event that that retiree has rental income or investment income, then that individual will be required to contribute.
Based on that income.
Yes, and they will contribute 7.5% of whatever income is declared monthly.
Okay, that's really clear.
I was saying earlier before the call, we intend to have providers in our network overseas also. And if you access care overseas, the provider in network is 20% co-payment and out of network 40%.
Okay. So let's make that simpler. If you go to the clinics here, don't care what the bill is, you don't have to pay
National Health
anything.
Insurance pays the total bill.
If you go to the hospital, if the bill is $100, you pay $5,
That's correct.
right? If you go to a private provider who's a part of the NHA, if your bill is $100, you pay $10. And if you go to a provider where that is not accepting NHA, is not part of the network, if your bill is $100, you pay $20.
Yes.
Okay. Now, how do you access the overseas care in the event that we don't have that care here? How does that process work?
We encourage each registrant to have a primary care physician in the BVI. When you access care
in the network.
In network in the BVI.
In the BVI. Okay.
When you access care at that primary care physician, in the event that they can't offer the level of care that is needed and it is not offered in the BVI, then a referral letter is sent to the medical review committee. The medical review committee, upon reviewing that referral, will then forward that patient to a facility overseas that is in network that offers the care needed.
Okay.
I would like to add something. Currently, for persons who have insurance, who need care that's not available within the territory, a similar process obtains. As for...
You have to go through that referral process.
There's that referral process. In other words, you have to pre-qualify.
So it's not peculiar to the NHA?
It's not something that is...
Just the NHA?
Yeah, that would be the new because of NHI. It is a practice now when you need services that are not available within the territory, then it has to be cleared with the insurance provider. So similarly, that is what would happen with NHI.
Persons are concerned that in the case of emergency, because
the same way that we handle emergencies now, the same way we handle emergencies under NHI.
So the review committee is not something that is going to, I got to set up a meeting tomorrow.
It's not the tribunal that's going to be setting up a meeting.
It's not going to be full of bureaucracy. They're going to make decisions immediately based on the needs.
Okay. And now when you go away and you get caught violent and something happens to you, and you might be in a location where there is no NHI network provider. Is your CAD valueless at that? Is your NHI valueless at that point?
No. In case of an emergency, and you're traveling overseas, we will cover the cost incurred when you access care. There will be a number on the CAD that will have to be accessed when there's an emergency situation, and we will have a 24-hour call center. Once that number is accessed, we will then make contact with the facility that you have access care to ensure that you get the best care necessary. And we will inform this provider of the financing mechanism that we have in the BVI and let them know that the financing is going to be taken care of by the National Health Insurance.
The other question of persons who have, persons are concerned about it, when they go abroad and they're accessing care out of network, from providers out of network, they have a 40% co-payment.
You talk about voluntary access or emergency access?
Voluntary access, not emergency access. Voluntary access is I think it's a 40% payment.
It's 40%.
It's a 5% payment. Okay. So, for example, if you went to get an operation for fibroids in Puerto Rico, and it costs, I don't know what fibroids cost, Dr. Potter, $7,000, $10,000.
I have no idea. Here's sister somebody on the radio saying house costs $10,000.
Sister Smith on the radio saying house costs $10,000.
I really don't know.
But look, just for argument's sake, right? Just for illustration purposes, let's put it that way. So if somebody went in, they had an operation that cost $10,000, they would then have to pay $4,000 of the operation if they access care outside the network. That's what we're saying, right?
That's correct.
Yeah.
That's correct. So how can a person mitigate that particular circumstance? How can a person who has NHI and wants to go voluntarily to a provider that's not in the network, for whatever the reason, in their mind they perceive, talking about perception, in their mind they perceive that, this is better. I'm a customer of this doctor, I'm a customer of this facility, and I want to go there. How they have a mandatory NHI, what can they do to help defer that cost of the 40% co-payment, which would be in that illustration about $4,000 out of the $10,000?
Well, we will have our network overseas, and if the physician that this individual wants to access care with is not in our network, we will have to examine the situation and see if we have more than one BVI lender who is registered with us accessing care at this provider. If that's the situation, the possibility exists of us bringing that person, trying to get a person into a network. If it's only one person accessing care at this physician, then we'll have to sit with this individual and try to point out to them the level of care offered within our network.
Is there a role, though, in that instance for a private insurance company?
You are actually asking a question that, in other words, I'm not a financial advisor. Mm-hmm. You are asking me how a person is going to meet a bill which they have made the decision to incur. But and you're asking me if the NHI would be able to mitigate or help them to mitigate, right? This is this is not quite an NHI responsibility. However, people would have options for financing care, as they now have options for financing care. If you can afford, you pay out of pocket for anything that is not covered by your insurance. That is what currently happens. If it is a special service, you might be able to access supplementary insurance to provide coverage for that additional service. Some persons, when they travel, for example, take out health insurance associated with their travel, right, as an option for helping to improve their security while they're overseas, right? Those are options that are available. I am pretty sure that those who can afford to to engage in accessing their choice would make determinations about which one of those options they are likely to bring into play to deal with the particular situation.
But when you talk about supplementing the NHI,
In other words,
is that an instance where a supplementary insurance would work, where you could say, well, you know, I have NHI, but I want to go to this physician or this institution periodically, and at my leisure, and I will take my NHI card, and they'll pay the $6,000, and I'll take my other private insurance card and get the co-payment paid through that.
Well, I'm pretty sure if there is a significant need demonstrated, that the persons who are in the insurance business would
create those kind of packages.
Would create a package to take care of the opportunity that presents. So it is likely that those kinds of scenarios will develop, where people would buy accessory packages to deal with special circumstances.
Because we talk about supplementary private insurance, and I'm wondering if that would be an example of.
Well, it really depends on whether or not the people who are in the industry and in that business elect and
go along
and have interest in providing those kinds of services.
Yeah, if persons in the population.
And if people are demanding and requesting,
and demand that,
then I'm sure people will.
The insurance companies will then provide something.
Will create a package.
Okay. Now, finally, before entering the clock. Are you able to tell us now what would be the next steps? We are in public consultation. You've been on radio and television for the last month or more. And what would be the next steps before NHI is implemented? Because as you heard Sister Smith say, she wants to know when this thing coming on stream because she got to pay for her fibroids.
Well, the most important step will be the enactment of the legislation. Until that is done, we can't move much further. So once that is enacted, then we can move hastily towards implementation.
So the next step is to bring legislation to the House of Assembly,
yes,
and have a debate and go and then have that pass, and then
while that is being finalized, we are having discussions with providers and with private insurance providers locally and providers overseas. Mr. Barry can speak to the details of the kinds of discussions that are being had. I think that involves their services, their fees, those kinds of things.
So you're creating a network all the time?
Yes, we are.
And we're making provisions to procure the reinsurance for the National Health Insurance Program,
the software package,
and the necessary software,
IT software.
For the information system. So those things are being worked on as we speak.
So reinsurance is a term that I'm not too familiar with. That is a backup insurance company?
Well, it's an underwriter for the insurance company and on the insurance program.
So to make sure that we always have money there for those who are concerned that the government is going to spend the money on something else.
No. Well, we expect the legislation to prevent the government from spending money on something else. The expectation is that we will have an NHI fund and a Social Security fund, and that the amendment to the Social Security legislation
never the twain shall meet.
Will protect the NHI fund. It will only be for health purposes.
Oh, okay. I hadn't realized it. Yeah, okay. So you got legislation coming, computer software.
Yeah.
You're building a network for local and overseas providers, and as soon as those things are in place, then we can expect that we'll have national health insurance. Now, and the final question, you talk about promotion of wellness maintenance. One of the things, one of the questions that some persons have, and I'm one of those persons that have that question, is at the rate we are getting sick. Right now we're at 47% of the population with one of the chronic diseases. And at our current rate of illness, it may pose some challenges for our finances. And a strategy that has developed in the Ministry of Health is wellness promotion. How does that fit into the national health insurance?
One of the unique features of the National Health Insurance Program is that it provides resources by law to help to finance health promoting activities. There will be a special fund set up within the National Health Insurance Program to support health promoting activities by communities, community groups, where they can access resources for activities that are demonstrated to promote health.
Well, I think we've answered most of the questions that I've gotten along the way from persons. I want to thank you, Mr. Barry, Deputy Director of Social Security responsible for National Health Insurance, for taking the time out to come to Spotlight.
Thank you.
And you, Dr. Potter, Chief Medical Officer at the Ministry of Health and Social Development. Thank you for taking time out. I know you guys are tired, you're busy.
Thank you for having us.
I appreciate you coming by the Spotlight to answer some of the questions that have been thrown at me.
Well, please,
during the course of that,
we're happy to say to the public that they can call the NHI office, they can come into the office, or they can meet us anywhere and ask, and we'll be willing to help to inform and educate, because we believe that good health requires access to good health care, and that good health care is necessary for good health. And if we have good health, we'll be able to contribute meaningfully to the upkeep and continued development of our territory. It means that we believe that people who don't now have to worry about how their health care will be paid for will be a happier and more productive people.
Well, thank you. And let that be the last one. If you want to have the last one.
The numbers at the National Health Insurance: 494-3418, extension 401, 402, and 403.
Say that again.
494-3418, extensions 401, 402, and 403. You can call us anytime from 8:30 to 4:30.
Okay, thank you again for being my guest. Spotlight is seen here on JTV Channel 55 Tuesdays at 8 p.m. and we broadcast Sundays at 2:30 p.m. You can also catch us on jtvlive.net. Any Spotlight you missed, any part of it that you missed, anyone you want to see again, jtvlive.net have a tag that says Spotlight. You can click on it and you can go directly to the show. Next week, members of the Tourist Board, the BVI Tourist Board, will be here to talk about their upcoming culinary events in November and share a little about their ongoing attempts to bring some more money into the territory by opening up new markets. Thank you for watching. Thank you for your words of encouragement, your suggestions, and your criticisms. Continue to email me at jtvspotlight@yahoo.com. I'm Edgerenka, reminding you that when the spotlight is on, you see the facts. Peace and blessings.
Spotlight is brought to you by Tortola Concrete Limited, Clarence Thomas Limited, and H. Lavity Stout Community College.